This educational program is sponsored by Eli Lilly and Company in association with the International Society for Bipolar Disorders.
That have shown that, on average, most people with bipolar disorder spend most of their time neither manic nor depressed nor well, but rather having chronic, mild depressive symptoms, not fully treated. And that those depressive symptoms are one of the biggest factors contributing to long-term or permanent disability in people with bipolar disorder.
Along the continuum between mania and depression are other mood states. One of these is the mixed state, a combination of mania and depression occurring at the same time.
Typically what happens is that patient is experiencing this dysphoric, distressing, irritable kind of mood with a lot of anxiety. They also tend to have a lot of thoughts going through their head, but these can be, these are often negative kind of thoughts, which again are distressing to the patient. In addition to that, they also can have significant increase in their energy, and also they might feel very agitated as well.
With mixed mania, you don't get the euphoria that a patient with regular mania would get. You get agitated, restless, anxious, very jittery, very nervous. And on the other end, you've got this debilitating depression. So, like I said, the mixed mania is kind of a combination between the manic and the depressive side, where you're really high, you're buzzing, so to speak, but it's tempered by this awful negativity of the depression. It's kind of the worst of both worlds.
Bipolar disorder is also characterized by cycling from one mood phase to the next. These changes in mood can happen over a few days to a few months. Sometimes these cycles will even coincide with the seasons.
About 8 years ago, my father passed away, and immediately following his death, I went into a fairly severe depression. And that recurred the next winter, the following winter, and pretty much every winter for the next 4 years. Each summer I entered into what was more definitely a manic state.
Even though we may have individuals who might have some manic symptoms at the same time as depressive symptoms, what's more typical is individuals who are in a manic state, the elated or the irritable state, for a period of weeks or even days to weeks or even up to a month or even more. And at other times, we'll be in a depressive episode for a period of weeks.
Increasing awareness in the medical community and in the general public has led to better diagnosis and treatment of bipolar disorder. The road to recovery begins with accepting diagnosis, learning how to manage the illness, and drawing on the support of family and friends. Now, bipolar disorder can become a part of one's life, not life itself.
As much as this is a very important, severe illness, there is hope. It's not totally a devastating situation, that there are wonderful treatment options out there for people, and that people with bipolar disorder can lead very productive, successful lives.
I said, well, at least they understand that it does exist and there is treatment procedures. That's a very hopeful thing.
It was an answer to me. It was an answer to me. And I didn't feel any shame about this at all.
Bipolar felt like home to me. It felt like my title. Not like it's an award, but it felt like this is what has been hurting me and this has been what is assisting me, and now I need to find a way to manage it.
One of the most essential elements in the long-term prognosis, how well do people do, not just in managing an acute manic or depressive episode, but how well do they do managing their illness over time, is the amount of support they get from family and friends. Now, that's not as easy as it sounds. This is an illness that can burn people out. It can challenge the integrity of close relationships. But I think it's important that family and friends understand about bipolar disorder so that they recognize, well, gee, this is behavior that's because of the illness.
Of course, my parents, they've been an immense support. When I was in the hospital, they came to see me every single day. They go to meetings put on by NAMI to help educate people about mental illnesses. So they're very informed as far as what this illness is, what are some of the signs that some sort of episode might be coming on. We have a really incredible network of friends and family. She's got a great support system, I think.
We were very tempted to toss Michael away, to say, get out. We can't deal with this, you know, figuring it was drugs. Once we realized it was a mental illness, it was almost like a relief. We could bring him back and love him and look after him.
Like any medical illness, bipolar disorder does require treatment. This often includes therapy or counseling and medication. Medication is necessary because it manages the brain's chemical imbalances and can greatly reduce symptoms. Still, many people find it difficult to adjust to taking medication every day. They will often miss the energy of their mania or have trouble tolerating side effects. Other times, they just feel better and think they are over their bipolar disorder. When medication is stopped, relapse becomes inevitable.
Every time a patient goes off the medication, within 5 years, majority of them, in fact, have a relapse.
I said, I quit. I'm done with the meds. And everyone was kind of alarmed. I wasn't. After I stopped taking my meds in October, my mood got better and it improved, and it got better, and it kept getting better and better and higher, to the point where I was pretty out of control. It was suggested that I go to the hospital. I didn't want to go, but they pretty much told me, if you don't go, you will be taken.
Compliance is a significant challenge in bipolar disorder because patients with acute mania, especially those that have the so-called euphoric mania, don't want to get treatment because they are happy, they're enjoying the state, so they don't want to come down.
The challenge is let them know that each episode of bipolar disorder that they have worsens the underlying disease state. Now that disorder is harder to treat. The medication that worked for you before might not work anymore, or I need to use a higher dose, or I need to use another medication along with it.
It became a war. It was my way or the highway, and I said, I'm going to do it my way. I'm just going to get off these medications and prove everybody wrong. Just completely do away with medication and say I'm going to prove the world that I don't have this disease. Until finally I got manic again. I said, okay, maybe I do have this disease, so let's try to make this work.
By taking this medication doesn't mean you're weak. It actually means that you're strong and that you have insight.
I'm really happy with the medication, like I said, because now I'm working with the doctors. Now I feel that we're on the same team rather than we're on opposite sides of the ball.
In an attempt to self-medicate, many people with bipolar disorder will also abuse alcohol or drugs. This can complicate the illness and interfere with recovery.
I didn't know why, but I actually drank 12 beers in like 4 or 5 hours. And then I thought, well, I got to get more beer. And I went, I got more beer. And I drank 20 beers that night. I stayed up till 2 in the morning. And then I only slept for 4 hours, right?
Today, advances in the treatment of bipolar disorder include new medications and new uses for existing medications. These advances can mean less risk of relapse and fewer side effects. With the right treatment, many individuals with bipolar disorder can lead full, productive lives.
With these newer medications and providing a solid foundation for our patients to actually do better, our goals are for them not to lead a life because of bipolar disorder, but in spite of it.
I don't believe that medication that helps me to become more stable and balanced takes away my creative flair, my sense of humor, or anything like that. I know for a fact that I can still laugh, I can still cry, and I can still be all of the things that make me me.
Bipolar disorder can be a devastating illness, but today it does not have to be. Today, there are reasons for hope.
It's not the end of the world, and it doesn't make you any less of a person or of a success. You just have to adjust. You're gonna change your life, and you're gonna move on, and you can still do everything you want to do.
I see myself becoming more healthy each year. I'm becoming clearer and able to do more things. I'm taking classes. I'm trying to learn again.
I feel as though I can actually go out and accomplish the goals that I've always had.
I'm looking forward. I'm not looking back too much.
I feel like now that I finally got the diagnosis, the sky's the limit. It set me free.